Hey everyone, I'm Lisa Jadan, and welcome to Menopausitive.
I got a good feeling.
Where we take a refreshingly positive approach to navigating menopause. If you're looking for practical tips, expert advice, and honest conversations, think of this as your personal pick and mix for how to optimize your body. Although we can't prevent menopause, we can redefine it. And that journey starts now. As we come to the end of the year, that in-between place where we're half reflecting, half planning, I've been thinking a lot about what it means to start fresh. Not in the new year, new you way, but in a quieter, more meaningful way. I heard Dr. Rangan Chatterjee say recently that one of the most important things we can do is carve out time for solitude. Time to actually listen to ourselves. How many of you actually do that? We're so busy running around for others or outsourcing how we feel to experts and tests that we forget our body has been sending us signals all along. Our period is like a monthly report card. A headache is a messenger. That feeling in your gut, the one that nudges you towards something or warns you away, it's not random. And yet, when it comes to perimenopause and menopause, so many of us ignore the whispers until they become full-on alarm bells. This time of year naturally invites a pause. So I want you to consider this episode an invitation. Stop outsourcing every feeling. Start tuning in. Your body is already speaking, and your gut might just be the place to begin. Because the science emerging about the gut microbiome is astonishing. It actually makes me giddy with excitement. And that's why today, our conversation is the perfect blend of science and practicality. Get ready for a masterclass in hormone gut health. Cynthia Thurlow, nutritionist, nurse practitioner, and the author of the upcoming book, The Menopause Gut, is here to help us understand what's happening beneath the surface as our hormones shift and how small, doable adjustments in your diet and nutrition can transform how you feel, sometimes even in weeks. Cynthia, welcome to Menopausitive.
Thank you. So I've been so looking forward to this conversation, Lisa.
Oh, me too. Since I tracked you down at the Health Optimization Summit, Cynthia was like surrounded by crowds of people asking her questions and wanting her time. And I was like, Cynthia, it's me. It's Lisa. We're going to talk soon. Anyway, so great to have you here. We're going to jump in because I have a million questions for you, but I want to start at the beginning to lay some foundations. Can you talk us through how our microbiome shifts from birth to puberty to perimenopause and beyond?
Yeah, it's really interesting. It wasn't until I started contemplating writing this book that I really got into the science of the gut microbiome and determining where are the times in a woman's life where the microbiome changes. And so when young boys and girls are born, their microbiomes are very similar. Now, there may be differences that are accounted for the types of food their mother ate while they were in utero or the type of environment they grow up in. But up until puberty, they're fairly similar. And not surprisingly, with the influence of estradiol and progesterone and testosterone, the microbiome dynamically shifts in different directions. And, from the time of puberty up until pregnancy, if a woman gets pregnant, again, the microbiome dynamically shifts and changes in response to alterations in these very important hormones. We used to just call them sex hormones, but I think it undermines the systemic importance of testosterone, estrogen, and progesterone. And then again, in perimenopause, we start to see dynamic shifts in response to changes in these sex hormones. So I think about things like the influence of estrogen on the microbiome is quite significant, and that's actually where most of the research belies around estrogen. But estradiol is very intricately interwoven with our immune system. And as we see alterations of estrogen in perimenopause, and just for listeners, Interestingly enough, we can have the highest levels of estradiol, predominant form of estrogen our bodies make up until menopause, in perimenopause, the 5 to 10 years preceding menopause, 20 to 30% higher. And this accounts for a lot of the symptoms that we experience that can be incredibly frustrating. Weight loss resistance, tender breasts, very heavy, I used to call them crime scene periods, a lot of alterations. A lot of women experience bloating, gas, diarrhea, constipation. And as we're kind of navigating, mid perimenopause into late perimenopause and then ultimately menopause, we start to see changes in diversity of keystone bacteria. And the keystone bacteria are things that keep, it's almost like there's the gut microbiome incorporates viruses and bacteria and protozoa and fungi, and they're designed to live in harmony with one another. As we're making this perimenopause transition, we start to see changes. We start seeing less beneficial bacteria. We may see more opportunistic bacteria or funguses or viruses, which can account for symptoms that are experienced. We see more inflammation, which is a byproduct of multiple things, but not the least of which alterations in estradiol. We start to see more propensity for leaky gut, which can lead to latent food sensitivities. It can lead to dysbiosis, which I always like to describe as weeds in the garden. The fruits and vegetables that we buy and we plant in the microbiome that are designed to be there to be beneficial, they start to shift, and we start to have these sometimes pathogenic, but oftentimes non-opportunistic bacteria or viruses or fungi that can be problematic. And then it becomes a constellation of other things. We see more autoimmune conditions. We see alterations in immune function, estradiol in particular. And there's a solid amount of research. Estradiol is important for creating the glue, if you will. Our small intestinal lining is one cell layer thick. Estradiol is very, very important for creating the mortar. If you want to think about it, I'm married to an engineer, so I'm always thinking of analogies. We have brick and then we put mortar between it. It's so that it's not permeable. But what happens is one cell layer thick, it's very easy to impact the permeability of that small intestine. And then the immune system is right there. So you provoke the immune response, an immune response in response to this damage, which then provokes inflammation, oxidative stress. Again, the food sensitivities. This is when women will say to me, oh my gosh, I've never been sensitive to dairy. Every time I eat dairy now, I feel bloated, I feel gassy, I'm miserable. And so it's these kinds of things that happen along with important things like we get a reduction in short chain fatty acids. And people will sometimes say, why do I care about that? That's things like butyrate, which I think most people have heard of, but they're very important for reducing inflammation, but they also provide information. And vis-a-vis colonocytes, which are cells in our colon, so our large intestine, very important for crosstalk and communication. And specific species of keystone bacteria that I mentioned, kind of the diversification drops during this transition, are responsible for endogenous GLP-1 production. What does that mean? GLP-1 agonists right now are very popular. We're talking about semaglutide, tirzepatide. It is not just unique to the United States. It is a worldwide boom in these drugs. And our body makes GLP-1 endogenously inside. But as we have less Akkermansia, which is that keystone bacteria, as we have less short-chain fatty acid production, it can make it more challenging to be satiated. It can make it more challenging to feel full. And so there's a constellation of things that go on. I mean, it's more than just that, but those are kind of the key things that are changing that happen very subtly for most women. And, it might not be until they realize they've got an H. pylori infection, or they have candida, or they have some type of symptoms that drive stool testing that get them in to see a healthcare provider, that all of a sudden they're like, oh, I didn't realize this was happening. And so all of this is happening amongst all these hormone changes. And, we have a loss of insulin sensitivity. There's a lot of things that happen.
And there's a lot, it's silent, right? Like a lot of it is happening inside until, kind of like I said in the intro, until these alarm bells go off, right? And until you're like really bloated, that, somebody comes to see somebody like you. And how many women do you think suffer from gut-related issues during perimenopause and menopause?
Oh, easily I would say 80%.
80%.
I think it is so prevalent in my practice that when I start going through the most common issues that women experience in perimenopause, and I know this from running programs and working directly with patients, even if they don't realize it up front, I'm like, oh, have you been experiencing an alteration in bowel habits? Have you noticed that you're having more bloating? Are you noticing you're getting more rashes or you're experiencing hives? Have you noticed that you've been diagnosed with an autoimmune condition? We know that the bulk of women, up to 90% of women that are diagnosed with hypothyroidism, have Hashimoto's thyroiditis, which is actually an autoimmune condition. And once you have one, you are more likely to have others. So I always say, if you have one autoimmune condition prior to menopause, you likely will develop more. And that has a great deal to do with this, again, intricate relationship between the immune system and estrogen in particular, vis-a-vis all these changes in sex hormones. So to answer your question, very common. And sometimes it's not until we sit down and have a conversation and I ask leading questions. Talk to me about your digestion. Talk to me about how often you have a bowel movement. Talk to me about foods that you suspect you no longer tolerate. And then we start with these conversations, and then they realize, like, oh yeah, I didn't realize that was, A plus B equals C until it was pointed out, because we still think of ourselves as 18 in our brains. We're like, I'm still 18 years old. I can eat anything I want. I grew up in New Jersey, and, there was a lot of pizza and Italian food, and, I can't eat any of that stuff anymore.
Yeah, 28 it was a good year for me. 28 was a good year for me. But a lot of this is new science, right? Like, we weren't talking about this 10, 20 years ago.
No, and I didn't learn about this. I trained at a leading medical institution, and at Hopkins, we didn't learn any of this. It's really been emerging research, I would say, over the last 10 years, but the last 5, it's been getting a great deal of attention. And for me, it's really that, curiosity of, looking at thousands of stool tests and saying, why is every single patient dealing with these 5 things?
Yeah.
Like, what makes sense? Why is this happening? And so for me, it's, the podcast, my kind of clinician hat, where I'm always kind of looking at the world a little differently, and then looking at all of these patients really kind of got me interested and curious about, like, what's really happening for women at this stage of life? Because I think the more we know, the more we can make ourselves aware of what we could be doing proactively. And, interestingly, in the book, The Menopause Gut, the first thing that I lead off with is, why did I get so sick when I was in Morocco? My husband and I ate the same food, and I'm the one that got so sick. And I'm like, oh, it makes so much sense now as to why I got so sick. And so I think for a lot of people, it's probably not until you have it doesn't have to be as dramatic as my experience, but I think for a lot of people, until they have a problem, they aren't even thinking about it. We're all on autopilot. I'm like, I'm healthy. I don't have to think about this. And I'm like, oh, there's a lot going on underneath the surface.
Absolutely. And the thing that I love about your book, and I mean, what this show is about, though, is that if you understand what's going on in your body, and then if you do build a strong gut and you take the steps towards building a strong gut, in your book, you say that you can decrease your perimenopause and menopause symptoms by 60%.
Yeah. Yeah.
I mean, that's unbelievable, just through food, diet.
And it's definitely, I mean, there's definitely this piece of, I'm very pro hormone replacement therapy. So let me be clear. It is both medication, supplements, nutrition, lifestyle changes, and they're all very important. And I would say everyone can make lifestyle changes. Every single person listening, let me be clear, that is a foundational element that I think is important, because I'll be the first person to say this. If I have a patient who eats a standard American diet, doesn't prioritize sleep, doesn't manage her stress, doesn't exercise, slapping an estrogen patch on her is not going to fix her symptoms. It is not. It may make her feel a little better, but it's not going to fix. Like, we really do need to reflect on the word pause, perimenopause, menopause. The word pause is important for us to reflect on what is no longer serving us at this stage in our lives. And transparently, there were a couple things that were fairly easy to change, and there were others for me that weren't that easy to change. I recall, I'll give you a good example. When I went dairy-free, it was really hard. I didn't even eat that much dairy, but it goes to show you what goes on with your brain chemistry and physiology, what lights up your brain. My brain really liked that 1 or 2 days a week of having a little bit of ice cream, or maybe I had some cheese. That was really hard to do. Whereas some of these other things for me, like giving up gluten, no big deal. That wasn't a problem.
Yeah, that's so funny. That happens to me with cookies. My brain lights up with cookies.
Yeah.
But we now know that the gut is so much more than just digestion. like you were talking about. It's influencing our hormones, our brain, our bones, our cravings, our sleep. So, I mean, it's almost every organ in our body. Can we hit each of these one at a time? Because I find all of these completely mind blowing. A friend of mine was just in New York and she came back and she said, Lisa, I want to know why everybody in New York is on antidepressants. So there seems to be an epidemic of mood disorders for women in midlife. What is happening with the gut brain axis? Am I calling it the right thing? Is that the gut brain
Yeah,
axis?
yeah. No, it's all these different organ systems. There's a gut lung axis, a gut brain axis, a gut bone axis. So that is completely appropriate. So I think it's multiple things. I think it's our ultra processed foods that are definitely not setting up. And let me just back up. Our gut creates most of our neurotransmitters, these chemical messengers in the body, serotonin, dopamine, all very, very important. So if you're not eating a healthy diet, and I'm not picking on anyone, I'm just saying, like, if you look at the research, you're not going to produce the same types or quality of neurotransmitters as you would if you're eating a nutrient dense whole food diet. And I'm not even saying it has to be any particular kind of diet. I'm just saying less processed, less things in a box, bag, or a can. Less ingredients you can't decipher. So I think part of it's the food. I think it's chronic stress, which leads to leaky gut. And certainly, I'm sure we'll talk about cortisol and how chronic elevation of cortisol can lead to leaky gut, which that's in and of itself another problem. But I think the larger issue is helping women understand that a lot of the anxiety, depression, ADHD symptoms that women are experiencing that magnify in perimenopause and menopause are a reflection of less progesterone. So progesterone is predominantly made in our ovaries up until, this perimenopause to menopause transition. And that's really what harkens the beginning of perimenopause. So as our bodies are producing less progesterone, that impacts our menstrual flow, how heavy it is. We get these alterations in progesterone and estrogen or estradiol signaling. We get alterations in sleep quality. We become less stress resilient. We become more irritable. And progesterone is an important hormone, and a byproduct of progesterone is something called allopregnenolone, which is a neurosteroid, but it's important for GABA. And GABA is this inhibitory neurotransmitter, very important. The opposite of GABA is glutamate, and that's excitatory, and that's what gets your brain moving and open. And it's an excitatory neurotransmitter as opposed to an inhibitory one. So with less circulating progesterone, we're getting less allopregnenolone. We're getting less GABA stimulation.
And we love GABA. We
We love
love it.
GABA. We love GABA. And it's
Yeah.
not just taking GABA as a supplement. I oftentimes will tell patients that if you take GABA as a supplement and it works, it probably is because you have a leaky brain. And we'll talk about leaky gut and leaky brain. And then also estrogen. I think a lot of people don't realize that estrogen is this nurturing hormone that is very important for behavior. It is our bond. It's one of our bonding hormones. Oxytocin is also important. But I tell people women feel irritable when they don't have enough estrogen around, or if they have too much in excess. And so I think it's both these alterations in estrogen and progesterone. I think it's our diets. I think it's chronic stress. And then I also think it's this, we've got an environment of, we can't not address the influence of social media. We can't not address the influence of connection. And I think for a lot of individuals, the pandemic certainly magnified this, that a lot of people are living fairly solitary, lonely environments. And we know loneliness can be as toxic as smoking. And that's based on research. It's not just me contriving that out of thin air. So I think it's multifactorial. I think it is multiple things coming together, but a lot of women who are put on antidepressants, there are certainly people who need them, or anti-anxiety medications. I don't want anyone to feel a sense of shame because the medications are there for a reason. But many women at this stage of life that are put on these drugs really need progesterone as a starting point, and they need estrogen.
Yeah.
And if you're in this life stage, if you're north of 35 and your prescriber is not having that conversation with you, they may not be aware. That's number one. Traditional allopathic medicine really doesn't teach us, doesn't put those pieces together. It's taken, more integrative and functional training to put those pieces together. But I think the other thing is women at this stage of life for many of them, they start to re-examine every relationship that they have, whether it's personal, professional. 70% of divorces, at least here in the United States, are initiated by women. Many of them are doing this in middle age. So I think there's a lot of alterations of people pleasing. Like, I'm a reformed people pleaser. And when, my estrogen started to wax and wane, I started to realize, I was like, oh, I'm really not a people pleaser. But that's estrogen. That's one of the things. Estrogen's a bonding hormone. And so I think for a lot of women, they start to question a lot of things. And that can be very sad. I mean, that can provoke situational depression, situational anxiety as people are examining what works for them and what no longer works for them. And then the last piece of that is, just like you can have a leaky gut and it's small intestine hyperpermeability, it is a real thing. If you have a leaky gut, you probably have a leaky brain, because there is a bidirectional relationship. There's a superhighway called the vagus nerve, longest nerve in the body. And this vagus nerve is constantly transmitting information back and forth between our gut and our brain. Just think about it when you get nervous or anxious and you get butterflies in your stomach. That is a byproduct of this communication pathway. So I oftentimes will remind patients that it's not just about the gut. It really is a systemic communication piece. And then the last thing that I will say is, when serotonin goes sideways during perimenopause, we make less serotonin, we make less dopamine. And so people will get alterations in how they feel, how they perceive the world, sometimes to our detriment, but also and sometimes will, exacerbate and magnify all these other things. So it is never just one thing. It is multifactorial that's contributing to why we start seeing food and mood disorders, why we start seeing many, many female patients saying, like, I've never had depression before. I don't know what's going on. Or why do I feel so anxious the week or two before my menstrual cycle? It's helping them understand there's multiple things that we can do that can help support them, not just in the short term, but long term.
Absolutely. And we're going to get to some of those tips later on. All right. Next one is the gut-bone axis. Dr. Von der Wright is going to be on the show, actually. I'm really excited. We're going to go
She's
deep
wonderful.
on bones. But I saw you in London a few months ago, and you dropped a killer stat. Women will lose almost 20% of their bone density within the first 5 to 7 years of menopause. Nobody is talking about this. I mean, we are now, but this is really coming up to this is a killer stat. And it's one of those things, again, that it's almost like in hindsight, because menopause is such a retrospective thing that you identify. So I am such a big believer in educating younger women so that they can prepare their body for a more positive menopause experience. But talk about how the gut impacts bone health.
Yeah. And I think it's important, and it's something Vonda and I have talked about several times. I'm going to be on her podcast in a couple weeks to talk about this specifically. Number one, peak bone mass in our bodies is between the ages of 25 and 30. I want younger women to hear this conversation, because how many young women appropriately want reliable contraception? I'm talking about teens and young adults. And there's never a conversation that if you miss out on laying down healthy bone as a teen or young adult, that has massive ramifications. My entire generation was put on oral contraceptives for wonky periods, birth control, whatever the reason was. And we didn't realize that if you start a 15-year-old, 16-year-old, 17-year-old on oral contraceptives, or something called Depo-Provera, which is an injectable contraceptive, and actually there's a black box warning on Depo in particular, which is reversible, let me be very clear. But if we are putting young women on these medications, we need to have a conversation to say, hey, you're going to have to do more to maintain bone mass and to ensure that you don't miss out on opportunities to build bone. It's critically important for young people, not just young women, but young men, to be athletic and to be doing things to help lay down bone in their younger years. So that's number one. If you took oral contraceptives, or part of my generation, or took Depo, you may be someone that's osteopenic in your 30s, and it's not your fault per se. It's that you are kept in a low estrogen state. That's part of what these drugs are doing to avoid ovulation. So that's number one. We have to be talking about this earlier, much, much earlier. Number two is, here in the United States, they don't screen women for bone issues until they're 65.
Oh,
So we
wow.
need to be screening earlier, doing things like DEXA scans, or there's some new technology called REMS, which is looking, or there's specific bone markers you can look at to look at bone health. I think we need to be doing that much earlier. And we lose quite a bit of bone when we breastfeed. So I breastfed for 2 years of my life. And I am the first person to say it wasn't until I interviewed Vonda and I started looking at the research, I was like, Vonda, I didn't realize how much bone mass we are losing in response to breastfeeding. Now, I'm not discouraging anyone from breastfeeding. I think it's if you can do it for as long as you can. But again, why are we screening women at 65 instead of in their 30s?
When it's too late.
Correct, when you can't do much. So, getting back to your original question. So I wanted to make sure I kind of mentioned those things. We need to be laying down healthy bone throughout our lifetime. And I think if we can identify people that are osteopenic, which is not yet osteoporotic. I mean, it's not, the severity is not there. We never want it to progress to osteoporosis. It's looking at what type of contraceptives we are recommending. It's looking at physical activity. It's looking at diet, but it's also looking at gut health because there is this interplay between the microbiome, the gut microbiome, and the bone building and bone breaking down process that goes on. So we have osteoblasts and osteoclasts, and they work together in conjunction with estradiol and progesterone and testosterone signaling up until menopause. It's designed to be like a seesaw. Again, I use the analogies. We want to ensure that we are balancing bone breakdown with bone building up, and it's a pretty efficient process. Then we go into menopause and the bone breakdown accelerates in response to alterations in these hormones that I keep talking about. Some people now call them pet hormones, progesterone, estrogen, testosterone, but that makes me think about animals. But
Yeah.
that's
It
a
does need
whole
a
other.
rebrand, though, for sure.
Yeah,
You're right.
exactly.
Yeah.
We're trying to find a better rebrand. I just don't want to
Yeah.
use the word sex hormones because it makes me think bikini medicine and not systemic medications. But the health of our microbiome has a great deal to do with the health of our bones. And so, our diet is important. Our stress levels are important. We know that estradiol in particular is primary prevention for osteoporosis. I'm going to say this again. Primary prevention, which means if you are taking a patch or a gel or whatever formulation, some people need to be on oral estradiol therapy in order to get their estradiol levels high enough to protect their bones. But primary prevention for osteoporosis, this is not just grandma fell and broke her hip. This leads to a loss of independence. This leads to people who end up in nursing homes. I just took a board exam. I want to say that it is up to 50% of women that fall and break a hip will never be back to their prior level of functionality. So when we talk about bones, it's not sexy. People think of it as, it's a structural organ. Well, it's so much more than that. It's really actually quite dynamic. And so again, it goes back to the health of our microbiome has a great deal to do with this crosstalk with bone health. And this is where I think it's very important to mention, the protein, the loading on the bones, making sure you're physically active, managing your stress, but it's also quite honestly, it is having that conversation. I know in the UK, HRT is much more prevalent than it is here in the United States, which is still criminal. And that's a whole separate conversation.
That's another episode.
Yes. But estradiol is primary prevention for osteoporosis. You need to be having a conversation with your prescriber so that you can start that earlier rather than later. Like my mother's generation here in the United States really lost out because of the WHI, and all of my aunts, all of my mom and all of her sisters, all of my aunts all have osteoporosis, every single one of them.
And I also think it's important for people listening to understand that young doesn't necessarily mean strong bones, and
Correct.
old doesn't necessarily mean weak bones.
Correct. And I think it's important to get the baseline. Like I will transparently tell you, I was on oral contraceptives because I had thin phenotype PCOS unbeknownst to me from 16 until 32. The entire time, 16 years. I did not know at 32 when I got married that I already had osteopenia.
Wow.
And it was not because I was restricting food. It was not because sometimes it's like, you're a dancer or a gymnast. Actually gymnasts have sometimes the healthiest bones. But it was just, I never had an opportunity to lay down healthy bone. And so I have to work really, really hard for the rest of my life to maintain bone health. And most of my generation, most of the women that I was friends with, for whether it was painful periods, heavy periods, wonky periods, PCOS, whatever it was, the answer to everything was oral contraceptives. So I think there's a lot of people that probably are walking around already osteopenic and don't yet know it.
Yeah, so I'm with you on, if you can afford to get a DEXA scan earlier, get a baseline, and then you have room and space to do something about it
Yes.
from that measurement. Now, the gut-vaginal connection. Now, we've talked about sexual health on the show, but I think it was in your book or I was listening to you. There is a rise in UTIs as we go through perimenopause and menopause.
Genitourinary syndrome of menopause. It is
Yeah.
a very astutely described syndrome. And here's the thing. I have women tell me all the time, like proudly, I'm in my 50s. I don't have any problems with painful sex. And I'm like, if you look at the statistics, by the age of 60, it's like 90%. So it's not a question of if, but when. But what's changing in the vaginal microbiome, which I find fascinating because I'm nerdy. Number one, when we have less estrogen. Estrogen is very important for lubrication. It's very important for ensuring that the lactobacilli that are lining the vaginal vault and walls are producing mucus, and they're happy, and they keep the pH at a specific range. So as the estrogen leaves, the pH changes, the lactobacilli die off, and we have more friability. We are more likely to experience chronic urinary tract infections. Because if you think about it, it's not just our vagina, it's the urethra, which is what carries urine out of the bladder. It's the whole pelvic floor is so responsive to estrogen and collagen and elastin, all of which go sideways in that perimenopause to menopause transition. So it's many, many things that are happening. And, it isn't just internally, it's also external. We get clitoral atrophy. In fact, I think it's Dr. Rachel Rubin who had this very famous discussion about, yeah, it actually happens. And younger women are like taking her video and running with it. And they're like, wait a minute, our clitoris goes away? And so I was like, I guess we got to start talking about it. But yeah, it can happen in response to these alterations, particularly in estradiol. It also, the loss of testosterone will also impact the muscular layer of the vagina. And so
is that why
can
we
mean,
always want to pee?
that is probably has more to do with estrogen. But I was like, anyone that's getting up at night to urinate, that could be the loss of estradiol. So talk to your provider. Vaginal estrogen, we should not proverbially, we don't want to put it in the water, but like it should be over the counter. It should be standard therapy. When you go in for that perimenopause check, here's your prescription. Like it should be that. Like if grandma is 90 years old, she can start vaginal estrogen tomorrow. Like it is so safe because it stays localized to the vagina. So the microbiomes, whether it's the oral microbiome, the gut microbiome, the vaginal microbiome, they're all interplayed. Just like you can get dysbiotic organisms in the gut, you can get them in the mouth, you can get them in the vagina. So it's very important that we utilize not just vaginal estrogen. I think either DHEA or testosterone are also very helpful, but no one should suffer. Like I was actually talking to my very young GYN, just doing my yearly pelvic because that's what you should just get checked once a year. And I was saying to her, do you find a lot of women get to a point where they just don't even care anymore about what's going on down in their genitourinary system? And she said, yes, because people are too ashamed to tell me. Like they don't want to say sex is really painful, or I bleed after sex, or I feel like I have chronic urinary tract infections, or I have stress incontinence, or I have urge incontinence. Like I put the key in the door and I start to urinate. And so I think there's still a lack of awareness and a lack of conversations like these so that women understand like this is normal doesn't mean that it's optimal. Like there are ways that we can address this. And a lot of the symptoms that women experience in the genitourinary system can be oftentimes fixed with something as simple as vaginal estrogen.
Yeah. And I mean, I always say menopause is a totally normal experience, but normal doesn't have to mean unpleasant.
Yes. And I sometimes am surprised / astonished excuse me, there are people out there that actually will fight with me on social media because they feel like if menopause is normal, we don't require medication. And I said, normal does not mean optimal. And whatever choice people make, anyone that's listening to, if you and your prescriber sit down and you have a conversation about what you want and don't want, and you understand the risk benefits of any choice you make, that is your autonomous decision. But I find there's still this fear around the hormone conversation. I'm like, at least consider the opportunity that maybe something you're experiencing could be entirely fixed with a really inexpensive option.
Yeah.
And why not consider it? Urinary tract infections are not benign. And I want to be really clear just so listeners can understand. So my background up until 9 years ago was in cardiology and ER medicine. So 20 years in cardiology and ER medicine. You better believe I saw a lot of little old ladies that come in that are septic from a urinary tract infection. It's called urosepsis. And many of them end up very sick and end up in the intensive care units for something that is completely preventable with vaginal estrogen.
I heard you talk about that in an interview, I think, with Gary Brecka, and I was like, what?
We need to talk about it. We need to yell it from the mountaintops. I mean, I saw too many people, too many women that died in the ICU because of something completely preventable.
Yeah. Oh my gosh. Okay. Get the grandmas, the vaginal estrogen, everybody. But talking about options, I mean, I could go on to talk about all the different connections between the immune system, sleep, metabolism. But let's get to the really meaty stuff, which I think everybody wants to hear about, is how we can use food, diet and nutrition to help women feel better about themselves. So in your book, The Menopause Gut, you talk about nutrition as ammunition and that women can really thrive when they adjust the way they eat in midlife. So what are the smartest nutritional shifts women can make that can deliver the biggest benefits?
Such an important question. Number one, you're probably not eating enough protein. And why is protein important? It's satiating. It's important that we understand we need more protein with age, not less. Like I always say, my teenagers can sneeze with 10 grams of protein and they'll stimulate muscle protein synthesis, which is what allows our bodies to help build muscle. At this stage of life, we need no less than 30 grams to do the same. And I would argue every meal should be 30 to 50 grams of protein. So whether you intermittent fast, and I know I'm known for that, and I always feel like I'm going to be apologizing for this for the rest of my life, you want no less than 100 grams of protein a day. So if you're not there, that's okay. Just start increasing your protein intake with each meal. And if you don't know what 30 grams of protein looks like, track it. There are apps like Chronometer. I have no affiliation with them. Track your macros, figure out where you are. If you're eating 60, increase it to 65 and get yourself up to 100.
Yeah. I take a piece of raw meat or fish, whatever, and it's like 150 grams on the scale, which I think equals about that. Or it's like, the size of the palm of your hand or something. That's kind of how I track it.
Yeah. Don't be embarrassed. If you're out to dinner, get the bigger steak. Get the bigger steak. If you don't finish it all, take it home. Or in my house, my kids finish everything. Number two, it's really important to understand what are smart carbohydrates. I am not anti-carb. I would not argue that every person needs to be ketogenic or even low carb. The right types of carbohydrates, green leafy vegetables, low glycemic berries, fruit, etc. And understanding that fiber is important. I know the carnivores hate when I say this. And actually, I jokingly said the other day, fiber is like the new F word because everyone, it's very polarizing, but fiber is important because as we are navigating this perimenopause to menopause transition, remember I mentioned we aren't making as much short chain fatty acids. These are important for anti-inflammatory purposes. They're also creating information for these colonocytes in the gut. But I think for a lot of people, fiber is very bio-individual. What works for me may not work for someone else. And I'm not talking about fiber supplements. I'm talking about getting nutrient-dense whole food fiber sources like you're getting from, again, green leafy vegetables, looking at, do you tolerate grains? Some people do, some people don't. Nuts and seeds. There's so many options. Find something that you like. Or the other piece of that is don't go to the grocery store and buy the same thing every week. Like I would encourage everyone to try something new, 1 or 2 new vegetables every week, for diversification. We know that plant-based compounds polyphenols in particular, these are the brightly pigmented fruits and vegetables. Our body needs about 30 different varieties, and that could include herbs, nuts, and seeds. So don't freak out. I'm not saying eat 30 vegetables a week. I'm saying diversify because that is what's important. Your body needs that information in the microbiome. There's a lot of different things that we could dive into, but I would say there's signaling molecules in those brightly pigmented fruits and vegetables. So don't be afraid of fiber. Most people are not eating enough. And what does that mean? If you're eating a highly processed, ultra processed diet, you might be getting 5 or 10 grams a day. And I would argue that we want more than 20. I think that's reasonable to start with. And the health of your microbiome has a lot to do with whether or not you tolerate fiber. When patients say to me, I ate 2 cups of Brussels sprouts and I was super bloated and gassy, I'm like, then back off on the quantity. Maybe you start with half a cup and you see how you feel. Maybe you have a quarter cup of lentils if that's something that's new to you and see how you feel. It is very
Yeah.
individualized.
And you can gently increase, can't you? You can start
Correct.
with a tablespoon. I just want to interject because on fiber, I wish I would have done more when I was younger. Because I find now having added it, so I, like most women, did not have a regular bowel movement. Like I would go 2-3 days, when I was
Yes.
younger. And you put it down to stress or, your GP just says, yeah, that's normal for you. But since I've been more mindful of adding fiber into my diet, I mean, it's made a huge difference to how
Yeah.
I feel in terms of bloating or how I metabolize things or how I, excrete, how often I excrete things. So that's one thing I wish I would have known or done more of in my 30s for sure.
Yeah, and it's interesting because I think it is very polarizing. There are people that say I'm full carnivore, and I'm like, I respect that. I did that for 9+ months after I was hospitalized in 2019. But the reason why I could not tolerate fiber for a period of time had a lot to do with what was going on in my gut after 6 weeks of antibiotics, antifungals, et cetera. So sometimes it's situational. Like my husband just came off of 6 months of antibiotics appropriately prescribed. And if I give him a lot of fiber, he's like, whoa, my body can't tolerate that. So it's quantity dependent, but just aim for more. I think that's very important. And I would say if you are not metabolically healthy, if you are someone that you've been told you have insulin resistance, you have fatty liver, you've got PCOS, you've been told you have high blood pressure, you've got heart disease, you might be someone that needs to be mindful of the quantity of carbohydrates that you're consuming. That doesn't mean no carb. That's not what I'm saying. I'm just saying, no more than 30 grams in a meal. So again, being cognizant of what that looks like. If someone's very physically active and they tolerate more carbohydrate, great. If they find that, they really have to be strategic about carbohydrates around workouts, make sure you're never having carbohydrates just all on their own. Make sure you have it with some protein or healthy fats. And then the other piece is just being mindful of healthy fats and what those actually are, as opposed to adulterated, processed seed oils, as an example. That doesn't mean that if you find a, super high quality, cold pressed sunflower oil, that's, I'm not saying that. I'm talking about the stuff that's included in ultra processed foods. That's the adulterated things that we want to avoid. But healthy monounsaturated fats that you get from like avocados, looking at nuts and seeds, if you tolerate dairy, butter or ghee, those kinds of things are important to incorporate into our diet for a variety of different reasons. But again, the power of the N of one. Some people do better with high protein, high carb or moderate carb. Some people do better with, less lean protein, more fatty meats, and do better with a higher fat diet. But you have to do a degree of experimentation.
Yeah, it's not the same for everybody. I also just want to point out, because I know on Instagram, because everybody's talking about it, I should have more protein. Like protein is getting a lot of PR right now. But in addition to what you had said earlier, I do want to remind everybody listening that, protein is fuel, yes, but it helps keep our energy stable, right? Like it helps with our muscle
Satiety.
and
Yep.
our bone growth. And the satiety thing, in your book, I was like, I heard of the protein leverage effect, and we've talked about it before on the show, but I want to repeat it here because I love the way you talked about it in your book. So for, you can describe, because I think this idea that if a good hint to you, if you're not eating enough protein and you
Yep.
want to snack, like this snacking
Yep.
analogy that you have, do you want to explain that?
So the protein leverage hypothesis is important. Number one, because we need more protein with aging, not less. We need much more. Number two, as our follicular stimulating hormone is going up because our brain is screaming to our ovaries and our ovaries are saying, hey, I'm like on vacation, I'm done, and your estrogen levels are going down, it magnifies this. So I remind women that when they say to me, yeah, I had a really busy day and I didn't have an opportunity to have my 3 meals or my 2 meals or however you structure your day, they're like, why am I in the pantry at 8 or 9 o'clock at night? Because your body, if you don't hit your protein macros, your body is looking for more calories. And you are generally going to get them from ultra processed carbohydrates and fat because you're like, what's in my pantry? It's stuff that can shelf stable, right? You're probably not diving into a can of sardines or some bone broth. You're going to grab the chips and the ice cream, and it's your body's way of making up for the calories that you did not consume that day. It happens to me too. It's like my check of, oh my gosh, go have a protein shake, woman. Just like get some food on board so that, if you don't have time to eat. But I think it's a gentle reminder. We need more protein, not less with age. And this protein leverage hypothesis ensures that if we are protein deficient, our body's like, I still need calories. I still need food. I'm going to get those from probably not the healthy stuff, not the stuff that is going to stabilize our blood sugar, contribute to muscle protein synthesis. A lot of women don't like the body composition changes that we experience in midlife. I get it, but that's not going to help your body composition. So just be mindful. You don't have to be perfect, but just be mindful of your protein intake. That will ensure that you are not staring mindlessly at the refrigerator, the freezer, or your pantry at 8, 9, 10 o'clock at night when we don't make good food choices, right? Like, let's just be clear.
Yeah.
If we're in desperation, our body's just like, oh my gosh, I'm starving. I just want to eat.
And then as we eat those snacks, the snacks are not improving it. So they're just asking for more and more and more. Anyway, I love
Correct.
the way you describe that. So, I've been so conscious of when I go in and I've opened up the pantry and I'm staring at it. What can I have right now? Especially at 4 o'clock or 5 o'clock when you want like a biscuit or a cookie or something. And then I try to make myself either some yogurt now or I'll make up a tin of tuna.
Yeah.
And it may not satisfy the sugar craving, but I find I'm satiated. And I can hold myself over till dinner.
Yeah. And I think it's also just validating, like whether it's like for me, my usually go-to is beef jerky. Like if I'm stuck, I'm like, okay, well, each thing of beef jerky is 6 grams of protein. So, if I need to get to 30, how many of these do I need to eat and or what can I combine with it? So always being kind of cognizant, mindful of what you can tolerate and put together so that the perfect example I have is I do a lot of travel. I try to avoid eating airport food as much as I can. So I have a little makeshift 30, 40 grams in my carry-on that's usually a combination of beef jerky, salted pistachios, and when all else fails, I do have like a fairly clean protein bar. Like if I need to get something on board, I need 40 grams, I can do my little makeshift meal. I don't recommend that over eating a real meal, but you'll get to a point where you'll know what you need to put together to be able to starve off. It's like, I'm not going to be able to eat a real meal till I land. I'm not going to be able to eat a real meal on this airport because everything is like junk, which is what most airports are like in the United States. Maybe there's a couple exceptions, but.
No, when I used to travel a lot, I would have like some cherry tomatoes, some cut up carrots, and then I'd have like a lot of nuts.
Yes.
And that's what I would be snacking on because the nuts you get on the airplane are too salty. So I don't want the really salty nuts
And sometimes
either.
it's these crappy almonds. Like I'm like, that's like my least favorite nut. Like I literally think to myself, you could come up with a million other options. That's like a crappy, dried out, stale almond. I'm like, yeah, pass. Pass. I'll just take my salted pistachios. Thank you.
Stick to you got the expensive nuts going there, just like the cashews. The cashews are an expensive nut. Okay, I can't speak to you. You talked about intermittent fasting. I can't speak to you without that. But what's your view on fasting with your perimenopause and menopause patients?
The answer is always, it depends. So if you are very lean, you exercise a lot, you probably are already in a relative energy deficiency. We call it REDS. That's the acronym. And, you have a wonky period, like comes and goes. And I think of the menstrual cycle as a litmus test, just like blood pressure, pulse, temperature. So if you lose your menstrual cycle, that might be a sign that you are doing too much hormetic stress. So hormetic stress, intermittent fasting, cold exposure, high intensity interval training, these are all examples of hormetic stressors. And I think that we really have to be cognizant of what's our sleep like? What's my stress like? Like if you're going through a divorce, a move, you lost your job, please, please, please do not add on more hormetic stress. So it's always dependent on where you are in your menstrual cycle. So if you're, from the start of bleed up until ovulation, when estrogen tends to be predominant, estrogen is our superpower hormone. We can get away with a bit more hormetic stress. That might be tougher exercise workouts. That might be, the day that you can do a little bit more cold exposure, heat exposure. You can probably get away with a little bit more fasting. And then after ovulation, that's generally when I encourage women to back off. So that's women who are still getting a cycle. In menopause, same thing applies. But if you're not sleeping, you're not managing your stress, you have a garbage diet, and you're not exercising, I tend to be more cautionary now than I used to be. But, for some people in menopause, that's the time they can get away with it because they don't have this confounding variable of shifting hormones week to week, day to day. So I think it's very, very dependent. And I wrote a whole book on this called The Intermittent Fasting Transformation, where I go deeper into the whys. But I think to reaffirm, especially around this book, I always talk about digestive rest. Everyone can do 12 hours of not eating. I think even my teenagers can do that safely and without issue. I think for a lot of women, that's a gentler way to give our bodies a break from constant barrage of eating. I think one of the statistics I read recently, people in the US eat anywhere from 10 to 12 times a day. When we look at sugar sweetened beverages and food, and you think about why do we have so much poor metabolic health? This is certainly not contributing in a positive way. So I think it's really being honest with yourself of, am I in a position, like maybe you're on vacation and you're like, I don't want to eat airport food. I can fast for 18 hours, not a big deal. But when I land, I'm going to eat and I'm going to go back to 12 to 13 hours of digestive rest. So I think it's highly dependent on the individual. That's really the point that I'm getting at. Are you metabolically healthy? Here in the United States, it's only 7 to 8% of us that are. So I think the topic of fasting can be one of many strategies that we can utilize to harness better metabolic health, but always with the context of where are you in your cycle? How are you doing with these other stressors to be able to determine whether or not you manage it? And the last thing that I'll say about this is over the past 10 years, have seen quite a few women that will hide their latent eating disordered behavior under the guise of fasting. So I think we just have to have honest conversations. Intermittent fasting is not telling anyone not to eat. It's just you're eating within a specific window. But if you are someone that has eating disordered behavior and you use intermittent fasting to hide it, like I just don't eat and I say that I'm fasting, that can be detrimental. And I want women to really be honest with themselves. I grew up in a time when women were conditioned to believe we want to be skinny. And I tell everyone we really want to be strong. We want to be focused on building healthy bones, healthy muscle, being able to remain independent forever. I always say forever is the goal, for as long as humanly possible, because it's not fun when people suddenly become or lose their independence and can't take care of themselves or be able to live the way that they want to.
Yeah. But I believe this idea of digestive rest, like when you talked about 12 hours, I mean, that's like stop eating at 8 o'clock at night and you
Right.
can pick up at breakfast the next morning. I used to be a constant grazer.
Mhm.
So like people used to laugh at me when I worked in an office. It would take me 4 hours to eat my lunch because it would just be beside me while I was doing stuff. But, I then learned that, I wasn't giving my body the messages on when to digest that food. So because there was just food coming in all the time.
Mhm.
And as soon as I even started giving myself those breaks between breakfast and lunch, and for other people, it could be smaller meals throughout the day.
Yep.
Like you said, different for everybody. But when I started giving myself those breaks, then my digestion started to flow. I guess it was flow. I don't know if that's the right way to put it, but you know what I mean. More rest was really good for me. So I really
Yeah.
noticed that different. I could talk forever about supplements, but I want to talk specifically about creatine only because, again,
Mhm.
that's getting a lot of PR right now.
Mhm.
And so a lot of people associate it with strength training, but there are so many more benefits to creatine, aren't there? Because I
Sure.
think you were talking when you travel, you kind of up your dose a little bit. Can you talk to us a bit about creatine?
Yeah, creatine monohydrate is a foundational supplement that I talk to every patient about. And I think it's that impactful. Like my entire house takes it for different reasons. My teenagers take it for strength training. I take it, for a little bit about that, but more for bone, brain benefits. And we're starting to see emerging research on gut benefits. And so that I think is really exciting. But to your point, because you mentioned it, if you don't get a good night's sleep, that's an indication to you can actually buffer the impact on your brain and your health by taking higher doses. What does that mean? Like we typically will say 5 grams. That's kind of a standard dose. We know we need more to cross the blood-brain barrier. And the blood-brain barrier is designed to protect our brain, but most of us probably have leaky brains because we have leaky guts. But we need a little bit more. We need 8 to probably 12 grams. I came back from a trip on Friday night with my family, and I probably had 4.5 hours of sleep, and said, as I was like walking down the street with my dogs, I was like, this is a day I'm going to have 10 grams because this is buffering the effects of sleep deprivation. Same thing applies when I travel abroad. I will start 10 grams, probably 2 to 3 days before I travel. And then I continue at the entire time while I'm away. And you can ask my family, I am a super sleeper. Like I get on, UK or EU time so easily, it drives my family nuts. Like I sleep solidly. And I think a great deal of that has to do with buffering with creatine monohydrate. We're seeing emerging research that's coming out that some of the benefits around the gut microbiome and supporting the gut in different ways, that's not as, the research isn't as persuasive yet, but it's certainly leaning in the direction that, this can be part of a supportive process for the gut. I will just dovetail and say that I think quality of creatine is important. Most of the creatine that is produced in China. And the way that it's produced, there's a lot of contaminants that creatine is exposed to. So irrespective of where you're purchasing from, look for products that say Crea Pure. That is actually products that have to be licensed out of Germany, the particular creatine monohydrate. And creatine monohydrate is the form of creatine that is best researched. And so I will oftentimes suggest it doesn't have to be my product for full transparency. It can be just make sure it says Crea Pure on it. That's the quality. That's usually some of the biggest complaints I will get from patients when they use the cheap stuff is bloating, gas, a lot of water retention, because creatine monohydrate, it's hydrating your muscle. Sometimes people will notice like a transient, 1 to 3 pounds difference on the scale. All the more reason, stay off the scale. Like don't weigh yourself every day. That is a practice that I think for a lot of women that is very destructive. But in the better quality stuff, I see little to no side effects. And that's important. So I always say, like, don't buy the cheap stuff. Invest in, if you're going to take it, invest in stuff that's higher quality. Generally, you're going to be less exposure to contaminants. And actually, I just did a podcast talking about some of these contaminants that are found in cheaper sources of creatine. So just kind of like buyer beware, just to be cognizant and aware. But I think the emerging research around creatine is really, really exciting. It is not the gym bro supplement that we all thought it was. We're actually seeing that women in particular, the other thing that I would say is women need more creatine by virtue of our physiologies. So depending on where we are in our menstrual cycle, we can make the argument that menstruating women still having menstrual cycles, there's times in our cycle where we need more creatine, not less. Menopausal women definitely can use creatine. And if you're vegan or vegetarian, because creatine sources from food, you're not getting it if you're not eating steak. And actually, steak and seafood, you'll get more creatine than you will from other animal-based sources. So if you're vegan or vegetarian, you absolutely need to supplement. And the research is pretty solid. Like sometimes those are the people who benefit the most because they just don't get enough exogenous sources in their diet.
Yeah, that top tip, everybody. Thank you for clarifying that. Talking about more top tips. Okay, before we get to our final question, Cynthia, can we do a quick fire round?
Sure.
I want to know Cynthia's New Year's menopause gut essentials. Okay? Okay, are we ready?
Yep.
All right. Best foods for gut hormone balance.
I would say obviously protein is going to be in there, but I would say secondary to that is really thinking thoughtfully about your fiber. And when I say your fiber, don't go buy like a bunch of processed psyllium and put it in a glass like grandma. There used to be ads here in the United States where people would like choke down this gelatinous, horrible mess. Be targeted about your fiber intake. Maybe you have a quarter cup of lentils like on a salad. Maybe it's, you're throwing some nuts in a bag, like you mentioned, you enjoy cashews and I like pistachios. but just be thoughtful about your fiber intake. Just think brightly pigmented things. When you're going to the grocery store, try something new.
I love that. One new supplement you'd like women to consider adding to their regime.
So we're not talking about creatine. So creatine's a must. I would say thinking thoughtfully about supplements that will help buffer the stress response. So we become less stress resilient as we're navigating perimenopause and menopause. Things that I see are helpful, like adaptogenic herbs like ashwagandha, rhodiola, relora. For a lot of patients, they find that it's effective to take them in the morning versus the evening. Experiment a little bit. Or adaptogenic mushrooms like cordyceps. I take cordyceps every day personally because I've had a hell of a last 18 months. So I think that, just be targeted with if you need a little bit more stress support, sometimes those adaptogenic options can be really, really helpful because they're very tonifying. Like if your cortisol is going, wah, it can help kind of lower your cortisol so that it's not so pronounced. And we all know how we feel when our cortisol's up. We feel a little edgy. Or if your cortisol is low, on the contrary, there are specific adaptogens that can also be helpful for that.
Biggest myth about menopause gut you'd like to clear up?
Well, it's a double entendre. So do I want to say that everyone, I don't want women going into menopause being fearful of body composition changes. So number one, there's a lot of workarounds that don't necessarily involve surgical intervention. Like I've had some patients just say, I'm just going to go get the liposuction. I'm like, I understand, but let's do these 5 other things first.
Yeah, give me 3 months.
Yes. I was like, if we do some targeted interventions, I think we can turn this around. The other thing is, whatever you're living with, whether it's constipation, diarrhea, bloating, rashes, brain fog, there's a workaround. I don't want anyone walking away and thinking like, this is my forever. And I think the most bothersome symptom of those is either the bloating or the brain fog. And sometimes that can be from a variety of different things, but bloating in particular is like the number one pain point other than weight loss resistance women experience. But just know there are workarounds for all of these things. You just have to dig a little deeper.
Yeah, nobody needs to suffer. One thing you want women to stop doing immediately?
Stop weighing yourself every day. In all seriousness, I think it's toxic. What I would say is get body composition readings quarterly. Like that is more valuable to know your lean body mass to fat-free mass. Like that is reflective of real things that you can tangibly address. I always say the scale is a liar. You get on that scale and maybe it's a day you're totally dehydrated and maybe you don't even feel good. And you're like, ooh, I'm down by 3 pounds. No, that's toxic. So it's part of that toxic diet culture. Stay off the scale, go by how your clothes feel, get a quarterly bioimpedance reading. Here in the United States, there's things called bod pods, which looks like a little egg, but it sucks all the air out. That can be equally helpful. Or having a bioimpedance reading where I mentioned you got fat-free mass to muscle mass. That can be very helpful.
Yeah, I have the reverse. Every time I have a Chinese takeaway, I'm up at least a kilo on the, the scale. It's really bad. I can't weigh myself for 3 days after that. One thing you'd like us to start doing tomorrow or in the new year?
I think that we need to do a better job of being kind to ourselves. And I don't say that to be trite, but I think that we as women we just beat ourselves up. Like I hear women, like the things women say to themselves every single time I'm working with someone, the things that they articulate to me, I can just imagine the internal dialogue. So whether or not it's, investing Gabby Bernstein has a meditation challenge. Again, no affiliation. I'm just giving, it's $30. So the equivalent in pounds is probably pretty negligible because I think the US dollar is not doing very well against the pound right now. Do something, invest in something for yourself because we do such a terrible job in many instances. Our internal dialogue is so toxic that I think we just need something. So literally every day I get into my phone and, there's a card that's my thought of the day. And it's I then hold that and I make space for it. And I do this before I get into email or even look at anything on social media. Just take a few minutes for yourself. And the other thing that I would say is I think it's very important. Do not check email before 10 o'clock in the morning if you can get away with that. That has been life-changing for me. My team knows. I'm like, if you need me, text me. I will respond. But I don't get into email before 10, which is sometimes really a problem from my team. But I remind them, I'm like, my blood pressure just starts to ratchet up when I open my inbox and I have 100 new emails. I'm like, ugh.
I'm the same. We started doing sky before screen, like my husband and and
Smart.
I can't even look at my phone. I have it on do not disturb, on
Yep.
silent, because when it is on, I can just feel myself just
Yep.
getting really, really agitated. Cynthia, the final question we ask all of our guests, knowing what we know now about the menopause gut connection, what would you tell our 35-year-old listener?
Give yourself permission to be attuned to the changes that you experience from the age of 35 to 40. I think that I took a lot of what I was experiencing and told myself it's because I've got young kids, it's because I work for this busy practice, when really what I probably needed was a little bit of progesterone in my 30s that would have helped my sleep and would have helped, some of the anxiety I experienced, especially after my second pregnancy. I had my second kiddo at 36. I had terrible postpartum depression, but I didn't, even as a clinician, I didn't recognize it as such. I was like, oh, I had him in the fall and I just didn't get enough sunlight. And I'm sitting in my closet 3 months after I have him and I'm like crying. And my husband's like, what's wrong? And I'm like, none of my clothes fit. And what I probably needed was some progesterone. So, but just remain attuned to changes that you're experiencing. Like, don't suffer. The point I'm making is, even as a clinician, no one had prepared me for perimenopause. Zero people, not my GYN, not my mom, not my sibling, like no one. And so I think I suffered for a good 4 or 5 years before I actually told my GYN, I was like, my periods are really heavy and like I'm really bitchy. What can we do about this? So just understand you do not need to suffer. Like that is my biggest message for everyone, but in particular, those 30 somethings that are still like in, the primo time of their lives, whatever your focus is, family or career or friends or loved ones, whatever it is, do not suffer needlessly. Ask for help. Do not suffer.
What would you tell our 45-year-old listener?
Perimenopause is a wild ride. It is a total wild ride, and it gets better on the other side. Start making those changes, because if you take really good care of yourself in perimenopause, that transition is going to be so much easier. And it's also like, don't fight the aging process. I think we are also conditioned to fear aging. And yet I've never been happier. I've never been more fulfilled. I've never I don't know, I've never been more confident. And I think a lot of women like need to hear that in their mid 40s to know like it's better on the other side. Like don't fear it. And actually it's like I find that women in menopause are just, they're free.
And what would you tell our 55-year-old listener?
Oh, the best is yet to come. There are plenty of 55-year-olds that are feeling great. And then there are just as many that are like, I feel forgotten. I feel like I'm trying to find a prescriber who can prescribe replacement therapy for me. I feel like I'm not 100% happy in my relationship or my occupation, or everything is fixable. Everything is dynamic and everything has a purpose. I think sometimes when life is tough, it's it's pushing us in a gentle direction. It's kind of reaffirming for us that we're meant to go in a different path. And I say this from personal experience, that I've had moments where I'm like, nothing is working. What is going on? And it's really just given me an opportunity to change something. So if you're not in the kind of perfect place at 55, just know it's temporary.
Cynthia Thurlow, thank you so much for being part of the menopausitive community. I feel like this was an early Christmas gift for me and everybody listening, because it was a masterclass in hormone gut connection. Thank you so much for being here.
Thanks for having me. It's been a pleasure.
It's been so much fun. We're going to put all the information in the show notes about how people can sign up for your book, which comes out when?
April 28th, 2026.
Woohoo! All right. So that will all go in the show notes. And I also saw you have some really lovely recipes in there as well. I'm going to try out one of those. I think
I
it
was
was
going
the
to say,
spicy tuna salad, the Asian
the
tuna salad.
amazing Beth Lipton wrote those recipes, and she's so talented.
Oh, that's amazing. Well, thank you again for being here. And for everyone listening, as the year winds down, let this be an invitation to reconnect with yourself. Listen to the messages your body is sending you. You don't need a full life overhaul, just a handful of small, intentional steps that move you toward feeling your best. See you next time. Oh, and by the way, I knew you were menopausitive when you downloaded this episode. Thank you so much for joining me today. I love bringing this information to you, and I love that you're taking control of your health. You can follow Menopausitive on Instagram, TikTok, and LinkedIn. If you haven't yet, please subscribe, rate, review, and share this podcast. Join me next week as we discover more ways to optimize our bodies. Because together, we're going to redefine menopause.
I got a good feeling.